We will continue with our discussion. We were talking about this paper here that was a review in the annual reviews of neuroscience published in 2022, so fairly recent. One of the things that I like doing is obviously integrating science into the practices that we have. And for some people, it's important. For others, it's not. For some people, it adds an element of groundedness in the practice, which can help. For other people, it gives them a greater reason to actually do the practice, or that if they know that something, let's say, medical is going on, or therapeutically physiological is going on, then they might actually do it more than saying, have a seat, take a breath. It'll relax you. When you understand some of the mechanisms that are occurring, that maybe you're actually more likely to do it, or more likely to believe in the power of the practice, Okay. In the chat is the link for the paper, and essentially it's breathing, rhythm, and pattern, and their influence on emotion. Published out of mostly Jack Feldman, who's he's at UCLA. It talks about how breathing and emotion, and that's the headline topic, is breathing and emotion. And so, what a lot of people don't recognize, for instance, is how powerful breathing can be from a therapeutic perspective. And many people I ask, for instance, have you ever had a thought that increases your heart rate? Or have you ever seen an image that increases your heart rate, right? Or a movie. You're going to a movie and it's a drama, or a thriller, or something like that. The images that you are going to see are going to, you're going to notice your heart rate increases, right? And most people notice, for instance, butterflies in their stomach. Maybe they're anxious to see someone, or they're anxious to give a talk, or they're anxious about going to the doctor or something like that. And so you notice that, I really don't want to go to this doctor's appointment, and you feel those little butterflies in the stomach. And so a lot of us kind of think of it that one unidirectional, thoughts and emotions and images cause stress. If it's one way, if you have a thought that can increase heart rate, then you can actually have a thought that can decrease heart rate. It's not only one directional. It's bi-directional, right? You can have a thought that increases your heart rate, and then you can have a thought that decreases your heart rate. You can have a thought that you can have a thought that increases your stress, and then you can have a thought that decreases your stress. And most of the time, we sort of ruminate on all the thoughts that increase our stress and don't really pay attention to the thoughts that decrease our stress. And so for this practice, essentially what we're saying is we need to, increase those thoughts that decrease our stress, increase our relaxation, et cetera, et cetera. And the same is true for the breath, right? The same is true for the breath. You have had events in your life that have changed how you breathe, right? That, let's say you get scared. What do? You take a little, you take a breath in, and then you hold your breath, right? And so emotions, thoughts, you can have a thought, and then all of a sudden you notice that you're breathing more rapid and shallow. And so we see it as very unidirectional as well. But what we're trying to drive home in this practice is essentially that if we can have emotions and thoughts that change our breathing, then what we've discovered is that we can actually use breathing to change our emotions and thoughts. Okay, and that's the power of the breath. That's the power of the breath, the power of the therapeutic benefit of the breath. Okay. And many of us don't recognize it, but we're already doing it in day-to-day life. We take deep sighs. Let's say we have a report or something that's due soon. When we finish it, or whatever it might be. But we use these things, right? I'm sure you've taken many deep breaths today. And what you're doing is you're rebalancing your nervous system when you do that. Right. And so now what we're just saying is, your body is doing this naturally. Why don't we bring some conscious activity to it, such that if you do feel stressed, anxious, panicky, et cetera, that you can actually modulate that with your breath, right? You can actually modulate that with your breath. And so we were going through this paper. If you're following along, it's on page 235, where it says breathing and emotion. Okay. And it goes through and it says, our emotional and cognitive states affect breathing, such as when we are stressed, relaxed, or attentive to solving a problem. Reversing this causality, so reversing it, breathing can affect emotion and cognition. Breathing can affect emotion and cognition, which is our thoughts. All right. And they look at specific examples of what we do and the differences between inspiration, breathing in, and expiration, breathing out. And there's a really nice image on the top of 235 that shows the different, as we breathe in, the element of surprise increases, our pupil diameter increases, the startle reflex increases, et cetera. And as we breathe out, we have the opposite. And really, it's about bringing resiliency to the nervous system. And so if we use the breath, we're sort of in a balance. We're sort of on a seesaw, up and down, up and down, up and the nervous systems are getting exercise, and it's balanced because we're breathing in a balanced way. Okay, and then in this research article, what they did is they proposed 6 different ways that this could happen, 6 different pathways. The first pathway, and remember, if you kind of think about the heart, right? The first pathways of the heart were the direct neuronal connections between the heart and the brain, right? Those are sort of the ones that we most think about, right? Oh, well, there's got to be a connection between the breath, our breathing, and the brain, and the direct neuronal connections. And there is. So what they say is we envision at least 6 different pathways, okay, by which breathing can influence brain associated emotion and cognition. The first being direct and indirect. These are, neuron projections, right? Neuron projections. And they project to different areas of the brain. And these are responsible for things like regulating breath, et cetera, but they're also interconnected with our emotions. The next one that they said was the third is what we talked about, the breathing modulated olfactory bulb oscillations, right? Breathing modulated olfactory bulb oscillations. And we talked a little bit about that in terms of how the breath, when you're breathing through your nose, there is a rhythmic pattern that is occurring on your what's called the olfactory bulb, which is the area of the nerves that come out of the brain that allow you to smell different odors. And when we breathe in and out with our nose, we're actually creating a pulsatile nature on our olfactory bulb. And this is actually giving information to our brain. Which is really neat. Some of the preliminary evidence suggests that breathing through the nose is more beneficial than breathing through the mouth. And more research is being done on this. And it definitely seems to be holding true. Okay, so that's the third mechanism. This is that breathing can tap into our brain structures. All right, the fourth mechanism is that simply breathing, paying attention to the breath, or being able to control the breath actually modulates the vagus nerve. the vagus nerve being cranial nerve number 10. It is the main nerve for our parasympathetic nervous system that rest and digest. So simply by breathing, you're actually stimulating the vagus nerve. Okay. Now, some of you may have heard of vagal nerve stimulations, right? It's actually a device that you put on your vagus nerve and send electrical activities to it. All right. What they found is there was a study done in 2017 here that stimulation of the vagus nerve alleviated symptoms of clinical depression in 50% of people. It's a lot, right? Simply by stimulating the vagus nerve with a device. Like, imagine you put a battery pack on your vagus nerve because it comes down your neck, right? Put a battery pack on your vagus nerve that sends an electrical signal. Bzz, 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 bzz. And that's one way of activating the vagus nerve is with an electronic device. I'm on page 237 at the bottom. 237. So if you took electrodes and put them on your vagus nerve and activated those electrons, you would be activating the vagus nerve and you would then feel relaxed. You would activate your parasympathetic nervous system and you might start feeling sleepy, relaxed. Your digestion would start to improve a little bit, et cetera, et cetera. Right. Well, simple breathing, right? So I'm always on the fact, yeah, okay, great, we have those, right? But what prior to that, what can we do to help bring some sort of balance, regulation to the nervous system, right? Well, simple breathing activates the vagal nerve as well. Simple breathing does too. So that's the fourth pathway. It says the fourth pathway is breathing-induced changes in vagus nerve activity. All right, and then the fifth one that I want to discuss a little bit today is changes in blood gases. And then the sixth one, so they had six, right? Six was the effect of how breathing, how we're expanding our chest, how we're activating our diaphragm, how all those muscles are interacting with the brain. And so there's signals that are going in from the muscles. There's signals that are going in from expansion and contraction of the chest and the diaphragm, et cetera, that are all going into the brain and giving the brain information. Okay. So that's kind of cool, right? When you think about it in terms of, wow, it's not only one mechanism. They actually propose 6 different mechanisms to do this by, which is like, sweet. This is cool. Right? Which mechanism am I going to hit on today? Am I going to hit on just the direct connections? Am I going to hit on the pulsation of my olfactory bulb? And you might resonate with one or the other, right? You might actually resonate with one or the other. All right, the fifth one is changes in blood gases. And the major blood gases that we're talking about are mostly oxygen and carbon dioxide. Usually what happens is that when we breathe in, we're breathing in a higher concentration of oxygen. And when we breathe out, we are breathing out a higher concentration of carbon dioxide. We breathe in the oxygen. The oxygen is taken up by the hemoglobin, by the red blood cells. And then that oxygen is deposited at areas in the body that need the oxygen. And it's pretty much every area of the body needs the oxygen. If we don't have oxygen, that skin dies or that tissue dies. When the blood gets to that area, and this is kind of cool, if I use my hand up and down, okay, not only am I increasing the blood supply to that, but I'm also increasing the carbon dioxide that's actually present in the tissue because I'm utilizing I'm contracting my muscles, et cetera, et cetera. I'm creating carbon dioxide from exchange of oxygen and gas exchange and muscle contraction and things like that. And then, so I'm creating a higher state of carbon dioxide when I'm using, because my body can regulate so quickly, it will actually increase blood supply to that area so that it has enough oxygen to supply the muscles and the tissues that are being used. As it gets there, and the hemoglobin needs to release the oxygen into that area, and then it picks up the carbon dioxide. So it releases oxygen, and as the oxygen gets released into the tissue, the carbon dioxide then comes into the red blood cell, binds to the hemoglobin in the red blood cell, and then it goes off into the lungs. And when it gets into the lungs, we blow the carbon dioxide off. All right, so it's a very, very dynamic relationship. Very dynamic relationship. Okay. So what happens when we hold our breath? So when I take a deep breath in and hold it, what am I not doing? I'm not exhaling, right? I'm not exhaling. And because I'm not exhaling, what happens to the carbon dioxide levels in our body? Well, they increase. Okay, they increase. And the more we're actually learning about carbon dioxide, the more we're actually seeing that some people actually call it a gas hormone, believe it or not. A gas hormone that can affect many different things, including how our glands function. Okay. Now, here's the neat part. When a tissue has slightly elevated levels of carbon dioxide, because of a chemical principle called the Bohr effect in gas exchange, if you have a slightly higher level of carbon dioxide, you are going to get increased gas exchange at that area. And so when the blood is cruising around your body, okay, and going into finding where I need to deposit this oxygen that I'm carrying, it's all based on a ratio. If the tissue doesn't need the oxygen and it has a lot of oxygen, it's not going to have a buildup of carbon dioxide. And so therefore, the hemoglobin is not going to release the oxygen into the tissue. It's going to keep it until it gets to an area where there's relatively low oxygen in the tissue, which means then that there's a relatively higher concentration of carbon dioxide. And then because of the Bohr effect, you deposit the oxygen. The oxygen can actually release from the hemoglobin and go into that tissue. Okay. So this is why this is so cool. And I knew that, it was going to take, because it's fairly complicated, but it's really neat because you are actually affecting all these things by controlling your breath. Okay, and what happens? So what happens is that when we're stressed or anxious or worried or panicky or something like that, how do we breathe? We usually breathe very irregular. We usually breathe very rapid. We breathe shallow. We're not, when we're panicky and sort of anxious, we're what's called hyperventilating. You might have heard that term, right? Hyperventilating, and somebody will say, "Stop hyperventilating," right? My daughter, freaks out about something, and she, okay, that's hyperventilating, right? Really rapid, really fast breaths, right? Well, what we're doing physiologically when we hyperventilate is we are actually blowing carbon dioxide out. We're blowing carbon dioxide out. We're getting rid of it. Right? So when I do this, my levels of carbon dioxide, I actually got a little lightheaded just doing that. My levels of carbon dioxide decreased instantaneously, just quickly, right? Levels of carbon dioxide decreased. And this is what they found. Chronic, so if I have low carbon dioxide, right? Chronic lowered blood CO2, carbon dioxide, is seen in approximately 70% of patients diagnosed with panic disorder and anxiety disorder. So because they're breathing quickly and rapid, they're getting rid of their oxygen. What they're doing is they're creating a physiologic state that is low carbon dioxide. Low carbon dioxide, because what are they doing? They're breathing all of their carbon dioxide out. Okay. When they raised their carbon dioxide levels to normal levels, this actually decreased the emotion of anxiety. That's pretty neat, right? That's pretty neat. The other thing is that when we start really kind of focusing on the breath is, remember what I said before, right? As we're breathing, if we hyperventilate, we're blowing away carbon dioxide. So we're creating less of a concentration of carbon dioxide in our tissues. So how likely is it that if we want to deposit oxygen in those tissues, that oxygen transfer is going to occur better when we have low carbon dioxide levels? It's not. So in essence, by hyperventilating, we're getting rid of carbon dioxide. And now, relatively speaking, right, we still need to survive. So it's not like our tissue's damaged, but relatively speaking, there's a less of a concentration of oxygen that is actually being able to be deposited into the tissues, because our concentration of carbon dioxide in the body as a whole has actually lessened. Okay, so that's why some people, for instance, when we start doing breathing exercises and we slow down the and we take deeper breaths, that you are actually slightly elevating your carbon dioxide levels in your body, which for every breath then that you take in and bring in the oxygen, your body is actually able to distribute that oxygen better to the tissues it needs to, because you've actually helped that transfer from increasing the carbon dioxide levels in the body. So now your tissues might actually feel as if they've come alive. Whoa, didn't realize that could happen. Tissues. It feels like there's a tingling, but not like a nerve damage tingling, right? Like a diabetes neuropathy tingling, like an aliveness, right? We can kind of tell the difference. Oh, this is it's like I just hit my funny bone, my ulnar nerve, right? Ooh, no, that doesn't feel, that's not very alive, right? But when you feel that tingling, that like your body is vibrating, right? It's resonating. You're like, whoa. And it's almost as if you can feel the gas exchange that's occurring and the oxygen being deposited at your tissues. Okay. The effect of a single or few deep breaths or sighs to induce calm is postulated to be due to the acute lowering of carbon dioxide. However, tissue carbon dioxide, unlike blood, are largely stable at short timescales, such as 1 or 2 breaths. So experimental evidence for an acute effect via this mechanism at shorter timescales is required. So we're looking longer timescales here, right? But still, that's what the purpose of a sustained breathing practice is. A sustained breathing practice is. Okay. Are there any questions about that? Because that's kind of like, those are the 6 mechanisms. We've talked about every one of them. I think they're really cool. The last one, of course, we took a little bit longer because it's blood gases, but you are affecting, when you change your blood carbon dioxide levels, you can ameliorate symptoms of anxiety that typically, when we are panicky or anxious, we're in a state of hyperventilation to some degree. And every time we do that, we blow off carbon dioxide. And so if we alter that mechanic, we can actually really improve or ameliorate the symptoms of anxiety. So does that make sense? Are there any questions about any of those? Because all 6 of those can be very profound. Sort of like when we looked at the heart and we looked at the connections, the direct connections and the hormones, and then the electromagnetic field, and then the pulsatile nature. You can see how much overlap there is in all these. Okay, so let's find a comfortable posture. A posture that you feel relaxed yet alert. Closing your eyes if you feel comfortable closing your eyes. If not, having a soft downward gaze. And taking 2 or 3 deep breaths. And just allowing yourself to be here now as best you can. And to bring your attention to your anchor, that place that you can direct your attention to that feels safer. That as your mind wanders and gets pulled off to any one of the activities of the mind, such as thoughts, emotions, or sensations, you simply come back to your anchor. And now, if you can, directing your attention to your breath. If you notice in your body where you notice the sensation of the breath the most, and notice it as a sensation. It might be on your upper lip as the air flows. It might be the expansion and contraction of your chest or belly. It might be the sensation of your whole body breathing. And with this practice, knowing that with every breath, you are directly regulating your physiology. And taking 2 or 3 deep breaths, and noticing that as you breathe, there's direct and indirect neuronal connections into your brain. And noticing how that makes you feel. Simply bringing your awareness to that anatomical and physiological connection. And taking another 2 or 3 deep breaths and feeling the pulsatile nature of the breath through your nose and on your olfactory bulb. That the breath goes up into the middle of your head and actually pulsates the neurons that are directly connected to your brain. And taking another 2 or 3 deep breaths and knowing that you're actively activating your vagus nerve. That we don't need an external vagal nerve stimulator. That we're simply doing it with our breath. And again, taking 2 or 3 deep breaths and knowing that we're altering our oxygen and carbon dioxide concentrations in our blood. That as we breathe rapid and shallow, we get rid of carbon dioxide. And as we breathe deep and slow, there's a relative increase in carbon dioxide in our blood. And as we breathe, taking 2 or 3 deep breaths, we're activating our chest, our rib cage, our diaphragm. Our organs, our liver is being pushed down when we breathe in. And that has a direct effect on our brain as well. Noticing how we feel. Is there any mechanism that you feel more connected to? Or do you feel connected to a few of them or all of them? Or do you simply feel connected to the breath? Whichever one it is for you, simply maintaining that practice. Breathing in and out, in and out. Knowing that with each in-breath and out-breath, you're directly affecting your brain in all the areas of emotions and cognition. Helping to feel more relaxed, at ease, and at peace. Just noticing where you are now, coming back to the breath if your mind has wandered. And noticing how many breaths you need a minute. Has your body felt more relaxed? And now, taking 2 or 3 deep breaths, noticing how you feel, both body, mind, and spirit. That with each breath, you actually sent little signals to your brain. And opening your eyes if your eyes were closed. Reorienting yourself to your room. Stretching if you feel like you need to stretch. And just taking a moment to reflect on your practice.